Heart failure is a pretty self-explanatory disease. It is exactly what it describes. The heart fails to pump blood into the body as successfully as it would in a healthy heart. This comes from trauma of some kind damaging the heart tissue. Trauma that can lead to this heart failure includes acute incidences such as myocardial infarction or heart attack, or they could be chronic injuries like constant high blood pressure and diabetes. Okay, so we're going to quickly discuss the epidemiology of heart failure. So the current estimated statistic is that we have 300,000 Australians who have chronic heart failure. We also have an estimated 30,000 new cases diagnosed each year. As we can see from this graph, we see the current time at around there, and we have a forecast of an increase throughout 2030. Now in Australia, we know that the Aboriginal and Torres Strait Islander peoples remain 2 to 3 times higher to die or at least be hospitalised with heart failure. However, the total amount of deaths from heart failure have fallen, whilst the incidence and prevalence is increasing, and obviously that's due to better diagnosis, early intervention, and more reported cases. Hence the forecasted trend. The forecasted trend is also there due to Australia's ageing population, improved survival from heart attack, and the increased prevalence of diabetes and obesity. So this contributes to more people living with heart failure essentially as time goes by as a percentage. Okay, so we're going to discuss systolic heart failure, which is one of the two left-sided heart failures. So in systolic heart failure, what happens is the left ventricle here is damaged in some way, say scar tissue, that inhibits the contractility power essentially, and when it goes to eject the blood out of the ventricle, it is insufficient as this cannot contract to its full capacity. So we have insufficiency here, here, and here, and here going into the body and leading to ultimately heart failure. Diastolic heart failure. Diastolic heart failure is the second of the left-sided heart failures, and what happens is the left ventricle is damaged in such a way that it cannot relax properly, say with left ventricular hypertrophy. You see a thickening which reduces the amount that it can relax. It sort of stiffens. It means that this preload here that comes into the heart to be ejected is not sufficient, so when this formally is ejected, it is not enough to go into the body. Okay, we'll cover right-sided heart failure. This heart failure is when the right ventricle cannot pump enough blood up and into the lungs. This is often a symptom from left-sided heart failure, as left-sided heart failure doesn't produce enough blood in the body, and this decreases the venous return and ultimately reduces the amount that the right ventricle can pump into the pulmonary vein and therefore into the lungs. There are many clinical signs and symptoms for heart failure. However, I have just listed the 3 major ones: breathlessness, increased heart rate, and edema. We experience breathlessness because the left ventricle cannot pump enough blood out into the body, so the lungs aren't receiving their oxygenated blood to function properly. We experience edema because as the cardiac output decreases, the venous return is very poor and blood backs up in the body, leading to an increase in pressure in the vessels, which leads to a leaking of fluid into the tissue. And then the next one, increased heart rate, is due to the body trying to compensate for the minimal amount of blood being pumped into the body. It's trying to maintain that cardiac output by increasing the heart rate because it can't increase the stroke volume any more than it is.